do. Thank you very much.
No problem.
Yes, I guess the question becomes, is that white wine good for our teeth? I think this guy might allow us to have some. We're going back to basics, and here with some simple tips to take care of your teeth is Dr. Richard Kuhn from Hudec Dental. It's good to have you here.
It's great to be here. Good morning.
We can have some, right?
We can,
What's
as long as we know our brushing and flossing techniques thereafter, yes.
I like this because we're going back to basics, starting with brushing. And it seems like such a simple thing that we do twice a day, sometimes more. But there is a technique, and there are ways that you can harm your teeth or you're not cleaning them properly just by using maybe even the wrong toothbrush or the brushing the wrong way.
That's correct, yes. It's critical to brush at least 2 to 4 minutes twice a day, but it does depend on how you angle the toothbrush and how much pressure you place onto the teeth. You want to be thorough and brush all 3 sides of your teeth, the cheek side, the chewing side, and the tongue side of your mouth. But if you push too hard on the bristle, it seems counterintuitive because people like to scrub their teeth to make it clean. But if you push hard, the bristles actually bend, and the grooves of your teeth on the chewing surface, they can be really tight grooves. So the bristles, when they bend, they actually skip the grooves. They don't clean out the sugar or the plaque or the tartar, or if you had caramel or things like that, wine residue, it leaves it behind. And then it becomes acidic and a cavity can happen. It's kind of like when you're sweeping crumbs out of the corner of your kitchen and you push the broom too hard, you can't get the crumbs out. You have to lightly tap the broom to get the crumbs out, similar to your mouth. So that's the analogy I like to use with my patients to really effectively brush your teeth.
So do you suggest then doing more of the electric toothbrush because it is lighter? You're not going to have that force that you would put yourself on it?
That's correct. It does help alleviate some pressure, but we're surprised to see some patients are still hardcore with their electric toothbrush.
Really?
They can still bend that bristle. So just a feather-like contact with the electric toothbrush and the vibration does the rest.
And it can affect your gum too. I know they were saying that I've been brushing too hard on my eye teeth and that's causing my gum to recede some.
It certainly can, yes. With too much pressure, the gum will respond to pressure by receding away from the pressure, the source of the pressure being the toothbrush. And it also, if you're right-handed, it shows up more on your left side, you're left-handed more on the right side. So that's how we notice people have receding gums.
Well, that makes perfect sense because it's on this side and I'm right-handed. Uh-oh. All right. So speaking of gums, flossing, so important.
It is absolutely critical. There's no substitute to flossing, regardless of what people have said in the past. It's the actual physical contact of the floss. And if we have that slide, there's a flossing demo with it.
Okay, here we go.
Especially the lower right corner where it says number 4. It's not enough to just go into the interproximal, we call that the in-between space between the teeth, just up and down. You want to go into the slot and curve to the left and to the right of that triangle. You see that pink triangle, that's your gum tissue. You do have to curve to the left and right of it. So it's 1 slot, 2 curves. Often people just go slot, 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 slot.
Sure, and they don't go all the way up to both sides.
They don't go all the way underneath. And the plaque will sit there and it'll ooze out acidic waste product. And then, unfortunately, you can have cavities that'll happen, and nothing in dentistry that we do will last forever. The goal is to do the best that we can for the patient, but then it's basically maintenance. Then we release you to the wild, so to speak. You eat, you chew, you function, and we see you every 6 months, but it's that flossing that has to maintain it.
All right. Now, what about when it comes to cavities? A lot of people, they don't realize they have cavities for a while because they don't hurt necessarily.
Yes, and we get that question quite often. I don't need to do anything because it's not in pain. And that's true, but if a patient waits until there is pain, like on this slide, for example, where that...
Is that the blue at the bottom showing the cavity, or what is that?
The blue at the bottom is the abscess, and the green arrow is showing what we call recurrent decay. So this patient had a crown in their mouth, and we can probably look into the mouth and it looks like a tooth. But that shadow over there where the green is, that's where you have a new cavity that went underneath the crown, probably from lack of flossing. And this patient should be in pain because the nerve is dying. The blue arrows show the abscess.
So that patient would see some pain with something like that.
Correct.
And then you would need a root canal with that type of...
At that point, that tooth has to be removed. Unfortunately, there's too much of a cavity. So it's best to catch it before it's in pain because then it's on the outside of the tooth where it's not under the nerve, and you can still save the tooth without doing root canal therapy.
And so what would you say would be the biggest misconception about, I know people, they get nervous to go to the dentist. No offense to you, but it's one of those doctors that everyone gets nervous to go to because I don't really know why they feel that way, but they do most of the time. But as a dentist then, what would you say is the biggest misconception and why it's so important to be coming to the dentist every 6 months?
Well, you know, they feel like they would want to have symptoms, and if they feel like their mouth is clean, they don't need to go. But the maintenance is the critical thing, and you know, these things are, it's kind of like a high blood pressure situation. You don't feel the high blood pressure until you have a heart attack, and it's the feeling aspect of it that they're missing out on.
All right, it's so good to have you here. We
Very
learned
nice
a lot.
to be
Getting
here. I
back to
appreciate your
basics
time.
here.
Thank you.
We'll have to have you back soon. Thanks so much,
I
and you can
appreciate
always
it.
go
Thank
to
you.
hudecdental.com for more information and to schedule your appointments. We'll be right back.